Hello everyone, welcome back to Comment Made Easy, and I hope you all are doing very well. Before we begin, let me remind my dear students that the contents of this channel are only to supplement your knowledge, not to replace the regular online and offline classes in your institution. So please attend your classes and do not miss them. Also, if you like our contents, please subscribe to our YouTube channel, like the videos, and share these videos with your friends, with your batchmates, with your juniors. Also, if you are a teacher, then with your students. Please follow our Facebook page, and the link will be given in the description. Today's topic of discussion is tetanus, which is a bacterial disease caused by Clostridium tetani. These bacteria, under favorable anaerobic conditions, produces tetanus plasmin, which is a potent neurotoxin, which is one kind of exotoxins. These toxins blocks the inhibitory neurotransmitter in the central nervous system and causes the muscular stiffness and spasms, which are typical of generalized tetanus. In this image, we can see at the nerve ending, we have both excitatory transmitter as well as inhibitory transmitter. Now, Clostridium tetani releasing the tetanus plasmin, and this tetanus plasmin blocks the inhibitory transmitter. Since the inhibitory transmitters are blocked because of the unopposed action of the excitatory transmitters, the muscles go into permanent spasm condition. So there is muscular stiffness and muscular spasms. Infection can occur through spores of the bacteria which are universally present in the soil. The disease can occur at any age, but it is particularly common and serious in the newborn babies in the form of neonatal tetanus. Neonatal tetanus is a very important topic, and we shall discuss in details. Tetanus among adolescents and young adults can also occur because of infection through a skin injury. Coming to the problem statement, in developed countries, tetanus is very rare nowadays, and there have been lot of initiatives all over the world to eliminate maternal and neonatal tetanus, and these various initiatives under the MNTE program led to significant reduction in the cases of maternal and neonatal tetanus. So according to WHO estimate, we can see as compared to 1988, there had been 96% reduction in the incidence of neonatal tetanus and death from the disease in the year 2015. Even in India, the number of safe deliveries rose from 52% to 76% in between 2007 and 2009. By safe deliveries, we mean the institutional or hospital deliveries. Janani Shishu Surakha Karyakram, also Janani Shirakha Yojana, and many other government initiatives where the mothers are encouraged to have their babies delivered at hospital have actually significantly benefited us in terms of lowering the number of maternal and neonatal tetanus. As of December 2014, 30 out of 36 states and urban territories were validated as having achieved maternal and neonatal tetanus elimination. And in the month of May 2015, India was officially certified as achieving maternal and neonatal tetanus elimination. So this is a very important MCQ Viva question. In the year 2015, we have been certified to eliminate maternal and neonatal tetanus in India. Coming to the agent factor, so this is a bacterial disease, as I mentioned, caused by Clostridium tetani, which is a gram-positive anaerobic spore-bearing organism, and it has an appearance of drumstick. The spores, so this is a spore-producing bacteria, and the spores can be destroyed by steam under pressure at 120 degrees Celsius for 20 minutes or by gamma irradiation. Reservoir of infection is generally the environment, mainly the soils and the dust. Sometimes it can be found in the intestine of many herbivores like cattle, horses, goats, and sheep, because they eat the grasses and the plantation on the ground, which are also contaminated with the spores. So that is why the spores can be found in the intestine, and these animals also excrete this spore through their feces. The spores survive for years in the nature. That means it can persist or survive in the nature for many years. So the toxin produced by the tetanus bacilli is the exotoxin, which is a soluble exotoxin, and it is highly lethal. And in terms of lethality, it comes only second to botulinum toxin. For a 70 kg person, the lethal dose is only 0.1 milligram. So 1/10 of a milligram is sufficient to kill a person with body weight of 70 kilogram. The toxin acts on 4 different areas in the nervous system: the motor inflating skeletal system, the spinal cord, the brain, and the sympathetic system. The principal action is to block the inhibition of spinal reflexes. We discussed this part earlier. Now, period of communicability is none because man-to-man transmission does not occur. Next is the host factor, the age. Commonly, it is a disease of the active age, that is 5 to 40 years. So, when the children go outside and play and interact with the environment, they come in contact with the spores from the environment. Also, young adults and the middle-aged people, they have to work outside their house, and also they get this infection or interaction with the environment leading to exposure to the spores. So this period predisposes to all kind of trauma, and therefore the risk of acquiring the disease is pretty high. Tetanus occurring in the newborn is known as neonatal tetanus. Infants typically contract the disease at birth when delivered in a non-aseptic condition, especially when the umbilical cord is cut with uncleaned instrument, or when the umbilical stump is dressed with ashes, soil, or cow dung. So basically unsafe delivery practices that can lead to neonatal tetanus. Regarding sex or gender, higher incidence is found among the males because males are more involved in outdoor activities, and that means they are more exposed to the risk. Females are more exposed to the risk of tetanus, especially during delivery or abortion leading to puerperal tetanus. So of course this is another issue. If you are talking about puerperal tetanus, of course that will occur among the females, and also there is high chance of neonatal tetanus because of that. Occupation. Agricultural work, not only agricultural work, but any kind of occupation that involves interaction with the environment will put the people at risk to develop the disease. Rural urban differences are there. That means there are more cases in the rural areas as compared to the urban areas. Also, if you are considering the urban people or urban population, it is the outskirt of the city where the earthen floors are present, where the cattle and pets are more abundant, and because of that there are more number of cases in the periphery of a city. So that is why the rural urban differences are present. Immunity, unless protected by previous immunization, no age is immune. After receiving 2 injections of tetanus toxoid, the person is protected for several years, but remember, it is not lifelong protection. When a woman becomes pregnant, that means the pregnancy is confirmed, we encourage her to take the tetanus toxoid 2 doses whenever applicable. This will actually confer some immunity to the newborn. So that is why by this only we can avoid neonatal tetanus. And in tetanus there is no concept of herd immunity because man-to-man transfer does not occur. Environmental and social factors. Now the occurrence of tetanus depend on man's physical and ecological surrounding. So the soil, agricultural, animal husbandry, and not on the presence or absence of the infection in the population. So as I mentioned earlier, there is no man-to-man transmission. So if the infection is present in the population, it will not determine whether more people will be infected or not. The environmental factors are compounded by social factors such as unhygienic customs and habits, like application of dust or animal dung to the wounds, unhygienic delivery practices like using unsterilized instrument for cutting the umbilical cord, ignorance of infection, and lack of primary healthcare services. Mode of transmission, it occurs by contamination of wounds with tetanus spores. And there are different kinds of wounds that can occur. For example, trivial pinprick, skin abrasion, puncture wounds, burns, human bites, animal bites, stings, unsterile surgery, intrauterine death, bowel surgery, dental extractions, injections, unsterile division of the umbilical cord, compound fractures, otitis media, chronic skin ulcers, eye infections, and gangrenous limbs. So as you can see, we have different kind of wounds that is possible, and if any of these wounds get contaminated by the tetanus spore, the disease can occur. There are certain events that occur after infection, like germination of the spores under anaerobic condition. Then the spores release exotoxin, and this toxin bind to certain receptors. These toxins then block the nerve impulses that allows the muscle to relax, and because of that the muscles cannot relax anymore and they go into permanent contraction state. Incubation period is generally 6 to 10 days, but it can be as short as 1 day and can be as long as several months. And the reason behind having this long incubation period for month is probably because the spores can lie dormant in the wounds. The different types of tetanus are traumatic. That means after any trauma, the skin ulcer or lesion, they get contaminated. Puerperal, that means after delivery. Autogenic, any procedure, autogenic procedure. Idiopathic, where the reasons are not known. Also the neonatal tetanus, that is tetanus neonatorum. Clinical features: tetanic seizure, which is typical of tetanus, which is painful, powerful burst of muscle contraction. If the muscle spasm affect the larynx of the chest wall, there can be asphyxiation. Stiffness of the jaw, also known as lockjaw. Stiffness of the abdominal and back muscles. Contraction of the facial muscles. Fast pulse or rapid pulse. Fever and sweating. A person suffering from tetanus undergoes convulsive muscle contraction of the jaw. This is known as lockjaw. The contraction by the muscle of the back and the extremities may become so violent and strong that the bone fractures may can also occur. The affected individual is conscious throughout the illness but cannot stop the contraction. So this is involuntary. Here in this photo or image, you can see the back muscles are more powerful, thus creating the arc backward. So if there is contraction of the back muscle, the person basically bends like a bow. This is known as opisthotonous position. So in case of generalized tetanus, it is descending pattern, like first there is lockjaw followed by stiffness of neck, then there is difficulty in swallowing, rigidity of the abdominal and back muscles. Spasm can continue for 3 to 4 weeks and recovery can last for months. Death occurs when the spasm interfere with the respiration. Now, maternal tetanus. Maternal tetanus is defined as tetanus occurring during pregnancy or within 6 weeks after pregnancy ends. That means there is birth or miscarriage or abortion, and has the same risk factors and means of prevention as neonatal tetanus. So this is basically an unit, the maternal tetanus and the neonatal tetanus, also known as maternal and neonatal tetanus, MNTE. For this reason, neonatal tetanus elimination, which is basically less than 1 case per 1000 live births, is considered a proxy for the maternal tetanus elimination. Coming to neonatal tetanus, which may occur due to unclean instrument to cut umbilical cord or application of contaminated material on the umbilical stem. So any neonate with normal ability to suck and cry during first 2 days of life and who between 3 and 28 days of age cannot suck normally, becomes stiff or has convulsion or spasms, that is jerking of muscles or both. So this is the typical feature of neonatal tetanus. Sometimes these features are given in the question and the examiner asks you about the diagnosis. So what does it say? It says the neonate or the newborn, he had the normal ability to suck. That means he was being breastfed and he was crying normally on the first 2 days of his life. Then maybe on day 3 onwards he had some problem. He cannot suck normally and he becomes stiff and has convulsions or spasms or both. So this is a feature of neonatal tetanus. The first symptom being seen about the 7th day. So more commonly neonatal tetanus, in case of neonatal tetanus, the first symptom begins around 7 days. It can also start earlier, as early as 3 days, but this is most common. Therefore, tetanus is known as 8th day disease. The first sign of tetanus in neonate is usually the inability to suck or breastfeed and excessive crying. So as you can see, on the first 2 days the neonate was crying normally and also was able to suck normally. But now this is the first sign: inability to suck or breastfeed and also excessive crying. Characteristic features of neonatal tetanus are trismus, that is lockjaw or inability to open the mouth; rhesus sardonicus, which is basically a facial grin; and raised eyebrows; and opisthetonous position, that is backward arching of the spine. There can be autonomic nervous system dysfunction like hypertension, abnormal pulses, and spasm of respiratory muscles and larynx can lead to respiratory failure. The case fatality rate of neonatal tetanus without treatment approaches 100%, though with intensive care this can be reduced to 10 to 20%. In the first figure, we can see the infant with tetanus demonstrating sign of trismus. So there is trismus and rhesus sardonicus. There is elevated eyebrows and facial grimace. And here we have the opisthetonous position. Like this is because of the contraction of the back muscles. Now, what did we do to eliminate neonatal tetanus? So elimination of maternal and neonatal tetanus. As a result of vaccination coverage, maternal and neonatal tetanus elimination has been validated in India in May 2015 by WHO. Nagaland was the last state to achieve MNTE. Elimination of maternal and neonatal tetanus means less than 1 case per 1000 live births across the entire country. This is a very important MCQ question. So what were the strategies which were used? Increase and sustain high coverage levels with 2 doses or a booster dose of tetanus toxoid in pregnant women. So basically immunization of the pregnant women with tetanus toxoid, 2 doses or maybe a booster dose if applicable. Increased proportion of deliveries by trained personnel. Intensify skilled birth attendance training. Supply of disposable delivery kits to ensure clean practices for home deliveries. First of all, we definitely want the mothers to deliver their babies at hospital. But if it is not possible, because in practical situation it may not be possible to have the baby delivered in the hospital, so sometimes home deliveries are to be conducted. And if home deliveries are to be conducted, it is essential that the deliveries are conducted by skilled birth attendants like trained DICE, and so they should also have their own training. These birth attendants must have their training. Implement essential newborn care including cord care to reduce neonatal tetanus. Strengthen surveillance system and undertake follow-up action in areas from where cases are reported. Continue information, education and communication activities in the community to promote clean deliveries with special focus in the areas from where cases have been reported and in cases where proportion of deliveries by untrained personnel is high. Now, how we can diagnose a tetanus? Tetanus diagnosis is entirely based on the clinical features and does not depend on laboratory confirmation. So, we have to look at the patient, the symptoms and signs and maybe history, and from that we can diagnose. Clostridium tetani is recovered from microbiological culture of wounds in only about 30% of the cases. So if we are taking some sample from the person, we may not be able to find the bacteria. So that means we can also miss the diagnosis. So that is why we do not depend on the laboratory finding. Prevention can be done by active immunization, by passive immunization, and a combination of active and passive immunization. Active immunization is done by tetanus toxoid vaccine. The aim should be to vaccinate the entire community and to ensure a protective level of antitoxin approximately 0.01 international unit per ml serum throughout the life. All persons should be immunized regardless of age. So, does not matter what the age of the person is, he should receive the vaccination. Two preparations are currently available, like combined vaccine like pentavalent or DPT. DPT was earlier available, now we have pentavalent, where we have diphtheria, pertussis, tetanus, along with that Haemophilus influenzae type B and hepatitis B. Also, there are monovalent vaccines like plain or fluid or formal toxoid. Also, tetanus vaccine adsorbed like PTAP, that is purified toxoid aluminum phosphate, and APT, that is aluminum precipitated toxoid. A primary course of immunization consists of two doses. So the person should receive two doses, 0.5 ml each dose, injected in the arm, given intramuscularly at the interval of 1 to 2 months. So ideally 4 weeks. The longer the intervals between the two doses, the better is the immune response. This is also very important. But that does not mean after receiving the first dose, the person should wait 1 year or 2 years to receive the second dose. It's not like that. The first booster dose, that is the third dose, should be given after 1 year of the first two doses. So that means whenever he receives the second dose, 1 year after that he should receive the booster dose. Sometimes additional booster dose are recommended uh, after 5 years, but again this is still under study and it has not been approved yet. Passive immunization is given by immunoglobulin. We have human immunoglobulin, also equine variety. So human tetanus hyperimmunoglobulin, it is the best prophylactic to use. Dose is 250 international unit, and it gives longer passive protection up to 30 days or more. Alternatively, we have ATS. When the human immunoglobulin is not available, we can opt for the equine option. The standard dose is 1500 international unit. It is also injected subcutaneously and it gives protection for about 7 to 10 days. Active and passive immunization can be given together, and in some situations they are to be given together. So what happens? The patient is given 1500 units of equine immunoglobulin or 250 units of human immunoglobulin in one arm, and in the other arm 0.5 ml of the tetanus toxoid is given. This should be followed by 6 weeks later by another dose of tetanus toxoid, that is the second dose. The purpose of antitoxin is for immediate temporary protection. That means suppose a person had a very nasty injury and probably there is contamination with the spores, tetanus spores. So for temporary protection, because giving the vaccine to the person, it will take a little bit of time to develop protection, but the person needs immediate protection, and for that immediate protection the person receives the immunoglobulin, but from long term protection he receives the vaccine. So this is the reason both active and passive immunization are given together. Now the question is, can antibiotic or should antibiotic be given in case of suspected tetanus infection, especially when a person's wound is contaminated with dust and soil, whatever? The answer is yes, it can be given, because number one, we need immediate protection and immunoglobulin may not be available everywhere. Sometimes immunoglobulin has its own drawback like hypersensitivity and all. Number two, vaccine does not provide immediate protection. So that is why sometimes antibiotics may need to be given. So single intramuscular dose 1.2 mega units of long acting penicillin like benzathine penicillin can be given, and it will provide protection for about 3 to 4 weeks. Alternatively, a 7 days course of erythromycin can also be given. Erythromycin 500 milligrams 6 hourly can also be given, which kills the vegetative forms of Clostridium tetani, but it does not kill the spores. Similarly, penicillin has no effect on the spores. So this is also very important. Antibiotics should be given as soon as possible after an injury, before a lethal dose of toxin is produced in the wound, which may be as soon as 6 hours after injury. Antibiotic prophylaxis should not be relied upon the patients seen later than 6 hours after the injury. So that means if 6 hours have elapsed since the injury, there is no point of giving antibiotic. It is not certain whether the antibiotic can reach the bacilli if there is dead tissue present in the wound. This is another reason uh, monotherapy with antibiotic is not effective and not reliable to prevent tetanus. So that is why we should always go for active and passive immunization, and uh, antibiotic cannot be a substitute or replacement for those options. Prevention of neonatal tetanus. The clean delivery practices, we have 5 C's, where clean hand, clean delivery surface, clean cord care, that is clean blade for cutting the cord, clean tie for the cord, also clean cord, that is no application on the cord stump. So this is important. This is a disposable delivery kit, that is DDK, which is provided to the trained DIs or whoever is conducting the home deliveries. So you can see there is there are a pair of gloves. This is the thread to tie the cord, gauze pieces, mask, maybe caps, surgical caps, gowns, etc. All these things are present in the disposable delivery kit. Also, here you can see the things, the list of the things which are present in the kit. Now, tetanus toxoid will protect both the mother and the child, and thus it can prevent the maternal as well as neonatal tetanus. In unimmunized pregnant women, 2 doses of tetanus toxoid should be given. The first one as early as possible during pregnancy. So whenever her pregnancy is confirmed, she should be offered the first dose of tetanus toxoid. And after 1 month of the first dose, she should receive the second dose. Ideally, the second dose should be taken at least 3 weeks before the date of delivery. If the woman was previously immunized with 2 doses of tetanus toxoid within last 3 years, then a single booster dose is sufficient. In areas where incidence of neonatal tetanus is high, the primary 2 doses course can be extended to all women of childbearing age, particularly if the present coverage of antenatal care is low. So that means any woman in the childbearing age, irrespective of the fact that if she is pregnant or not, should be given 2 doses of tetanus toxoid. Now this is a chart which is present in any standard textbook, and it is the list, or rather it is a flow diagram about how to prevent tetanus after an injury. This is actually a part of long question. So all wounds should receive surgical toilet, so it should be thoroughly cleaned with soap and water, etc., etc. And we have to categorize the wound. We have to see whether the wound is of less than 6 hours old, if it is clean, if it is non-penetrating, and if it is with negligible tissue damage. Alternatively, it can be more than 6 hours, it can be dirty, and can be penetrating with negligible with significant tissue damage, and those will be considered as other wounds, this category, right? Then we need to ask the person about his history of tetanus immunization. So if the person had received 2 doses of tetanus toxoid or even a booster dose in last 5 years, he does not need anything. Maybe he received his immunization between 5 to 10 years back. So that means he will receive only 1 dose. Similarly, if he received booster dose or maybe a complete dose 10 years back or even earlier, then he will need a single dose. But if he does not have any recollection of previous immunization, or maybe he took the immunization but he did not complete the course, in that case he should receive both the doses of tetanus toxoid, that is toxoid complete course. This is in case of new wound which are clean, non-penetrating and with negligible tissue damage. Now in case of other wounds, that means those wounds which are more than 6 hours old, which are dirty, penetrating and with significant tissue damage, same thing. But here also in case of category A, that is the person had complete course of toxoid or booster within 5 years, he does not need anything. B, same as the previous category, only 1 dose is sufficient when the person received the toxoid complete course or the booster dose between 5 and 10 years back. Now if he received the booster dose or the tetanus toxoid complete course 10 years or earlier, in that case he should receive only 1 dose, that is the booster dose, as well as human tetanus immunoglobulin. If the person does not remember anything about previous immunization, or maybe he remembers that he took incomplete course of the tetanus toxoid, in that case the complete course, that means the 2 doses at 1 month interval, should be given along with the human tetanus immunoglobulin. So as I mentioned, this is a part of the long question. You will be given a situation with a description of the wound, the kind of wound. Maybe he will say that the wound is 10 hours old and it's dirty, there is a significant tissue damage, so we have to go for this right hand side part. And also about the immunization history of the person. According to that, we have to decide whether he belongs to immunity category A, B, C and D, and then the appropriate treatment should be mentioned. So with this we complete tetanus along with a neonatal tetanus. If you like the video, please subscribe to our channel, share this video with your batchmates, with your juniors and also with your friends from other colleges. We also have our Facebook page, the link is given in the description, that you can follow. Take care and we shall see you in our next video.